Hey everybody, it's Dr. Wellwood here. So we've got a patient here who's got some lower back pain that goes down the left leg and then goes all the way down to the right as well. Yes. Does it go past the knee?
Generally stops at the knee.
So it stops at the knee. He's also having issues when he's bending backwards as well, is that right?
Yeah, almost feels like I'm going to fall backwards.
So it feels like it's going to fall backwards. So how long has it been going on?
Right now, a little over a month.
So over a month. So when this happens, oftentimes the patient feels that other issues tend to come up, such as balance problems. You've been having problems with balance?
Yeah.
Okay, so that's pretty common. So sometimes when the back goes out or we have issues with the nerves or the muscles in the back, the body compensates. So we're going to do a full examination on him today to kind of figure out exactly what's going on, and then we'll go ahead and treat him as well. Go ahead and stand up for me. So what we're going to do is go ahead and face this direction here for me. So go ahead and bend over at the hips for me. So first things first is when he bends over, you can actually see a large hump right here. And sometimes that hump is a really good indication of a vertebra actually being stick out backwards. Go ahead and bend backwards for me. Pain when he did that, okay. How's that?
Yeah, tightness in the lower.
Tightness in the lower area?
And the shoulder blade area.
So, so that is that mid-back pain you're talking about? Okay, let's go ahead and come back up for me. Okay, bend back for me again. Okay, and how's that? Pain in the mid-back there?
Not, this time it's not doing it as pain. Okay. So it was just 30 seconds ago.
Okay, great. Come back up. So he says he's feeling better when versus the prior time that we've done this. And sometimes that's a good indication that we're having some muscle fatigue. Now, if I check in between his ribs right here, is that it?
Yeah.
So he's got some really bad muscle spasms in between the ribs themselves. So sometimes when we're having multiple areas of pain, it's not just one single condition, it's actually multiple issues that are going on that aren't necessarily associated. So go ahead and bend to the side for me. Good. You can see how he's actually lifting his leg up right here. That's an indication that we have some other muscle spasms that are going on. Go ahead and try the other side. And see, he actually bends his knee over here. So right there, we know he's actually got some nerve compression that's going on. Come back up for me. So both of them are compensations. He lifts his leg up on one and then he bends it on the other one. So his body's innately trying to decompress itself or not injure that area. So go ahead and twist for me. Good. Good. Clunk, clunk. Good. Okay, now to go ahead and do a squat. We're going to do a squat to see how his muscle contractions are, his muscle motions are. Good. Now come back up. How did that feel?
All right.
Okay. Go ahead and have a seat for me. Let's go ahead and scooch back a little bit. Perfect. So I'm going to lift his leg up here a little bit. We're going to check his knees. Go ahead and relax for me. Good. So you can see he's got some regular reflexes there. Relax it. And he's got some good reflexes there. So it's not to the point where it's actually causing a lot of damage to it yet. Go ahead and lift that leg up for me. Straight as you can, as far as you can. Any pain there in the lower back? Good. Now the other one. How about that one?
No.
Good. Go ahead and lay on the back for me. That's called Braggart's test. It's a really good test to see if he's got a disc herniation. So go ahead and lift this up straight as you can, as far as you can. How about that one?
Just tightness in the back of the leg.
Tightness back here?
Yeah.
Okay. Let it go down. How about the other one? How about that?
About the same.
Okay, same. Okay, how about now both at the same time? We'll make them work for it. Any pain there?
No, just
tightness. Okay, slowly let it go down. Is there any increase in pain as you kind of slowly let it go down? Good. So all of those tests there are a really good indication that he does not have a disc herniation. So we're going to check his leg length here. It looks really good. So sometimes when a patient comes in, they'll actually have pain down the leg on either side, and we're always thinking of a space-occupying lesion or a disc herniation. That is not the case here. He's got normal reflexes. His orthopedic tests are relatively normal, so we're going to look more at a local muscle and joint issue. So go ahead and flip over on the belly for me. So when he's getting up, we're just kind of generally observing how well he's moving anyway. So when we're dealing with muscle stuff, we're going to be looking at another test called a Yanda key movement pattern. And Yanda was a doctor in Eastern Europe who found that muscles tend to fire at specific sequences in order to keep us upright and going straight. So what we're going to do on him is we're going to see if any one of those muscle activities is actually lower, which could be causing some of his condition. So go ahead and lift your left leg up nice and slow. So right there I can feel that he's actually contracting his left hip there. Okay, and we'll let that out. Now lift this part off the table for me. And what I'm doing is I'm checking to see if this one fires before this one here, and it does, and let it go down. And then I'm going to move up here to the glutes and then the lower back. Do the exact same motion.
Like that.
Perfect. And what you should be feeling is this fires before this, which it does. Go ahead and let it go down. And do it again. And this should actually have the right lower back and the left mid-thoracic area. And it does a little bit. So go ahead and go down. Now let's try the other side for me. So his firing, you get a little bit off here. So compared to his left side, his right side had a right glute that was firing more and first compared to his left side. Go ahead and let it down. So that's a good indication he's had chronic issues with the nerves on that side where the nerve and the muscle actually meet. So let's go ahead and do that again for me, please. Okay, good. Let it relax down. So again, his glute fired before his leg. So that might be something we want to consider rehabilitating with like balance exercises. Go ahead and do the right leg again for me. Good, and let it down. His left lower back fired just appropriately. And go ahead and do it again for me. And there we have the issue. So we can see, go ahead and let that down, that when he lifted his left leg up, his left lower thoracic area fired appropriately. But when he raised his right lower, his leg up, his right lower thoracic area did not fire at all. And this happens to be where he's actually in a very similar area where he's having this mid-back issue. Is that about right?
Oh, yeah.
So he's like, yep, that's definitely right. So this is oftentimes due to a muscle contraction. So if I push on it, that right there, you can see him jumping. And that is called a jump sign. So that's a really good indication that this is probably one of the areas he's actually going to be treated first for. As I'm palpating his spine, I can feel that there's a rib sticking out over here, and ribs tend to actually go backwards and up when we are exhaling and inhaling, and sometimes those get stuck. And they get stuck particularly when we're pushing or we're pulling or we're lifting and we inhale first. So it's that big, and then we try and move it. He's a mechanic, so he's under, I'm assuming you're under unusual lifting all the time, right?
Yeah.
Yeah.
Weird angles and everything.
Weird angles. Are you holding your breath while you're lifting?
Yeah.
So there you go. He's holding his breath when he's lifting. So if you have this chronic rib pain or this pain that is worse when you take a deep breath in and sometimes it wraps around the side, that's a good indication you actually have a rib dysfunction. His happens to be this muscle group that actually attaches to the rib. So his diagnosis right now, when I actually look down here on his lower back, that one spot that was popping up is right here. Is that tender at all?
Yeah. So,
Okay. Is that cause pain down the leg at all?
No, not down the legs.
Just right there.
Yeah.
Okay, good. How about over here?
No, that's fine.
Good. How about this right side again?
Yeah, actually.
How's that feel?
Actually, it's starting to kind of feel good.
Ah, so there you go. So he's saying it's starting to feel good. So this is a good testament for that we think that we might have a disc herniation, but it's actually due to muscle and localized joint inflammation. So because he's having pain from here going all the way down, we're going to call that a Facet syndrome. Facet syndrome looks a lot like a disc herniation, and it looks a lot like sciatica, but it doesn't always have to go all the way down to the leg or even the calf like sciatica does. It can tend to stay local, and he will actually avoid weight-bearing activities. And if you remember his examination that we did, he avoided all activities in that area. So he's literally jamming two weight-bearing joints together, and that would be called Facet syndrome. So the way we're going to treat it is we're going to open up those stuck joints to see how they actually move. So let's go ahead and lay on the right side for me. Okay, and then bend this knee here. I'm going to pull you over here, and we're going to bring this joint into its most tight. Here, there. And then the way I do it is I actually like to bring the leg out as much as we can, because it even tightens up and opens up that lower joint there. Take a deep breath in. Let it out. There we go. Good. Go ahead and lay in the back for me. Good. Give yourself a nice, big, loving hug. We're going to get that rib. There. Take a breath. Let it out. Yeah. Oh, there we go. There. That was good. He's got an upper respiratory infection too, so how did that feel? Did you feel it move?
Yeah, I'm
shock and awe.
Yeah, I was going through this for over a month, so
yeah.
I think that was a good thing.
That was a good thing. Let's go ahead and flip over on the belly for me, and let me check that muscle group again.
Yeah, it was a good thing. I feel it better.
So, you saw how much he guarded and how much he was tight. That's a really good indication of how much pain he's in. So you always check after the adjustment, after the treatment's been made, to see if you actually made something improvement. So I'm pushing on the same bone. How's that feel now?
No big deal.
And you can see how much I'm actually pushing. Let's go ahead. How's this muscle right here now?
Well, it's tight, but I mean,
it's tight?
Yeah.
And how's this one up in here now?
Yeah, no more.
No more. So let's go ahead and check that muscle pattern again. So lift that, that right one was the bad one. So go ahead and lift that right one up for me. And immediately you can actually see he's starting to activate the hamstring instead of the glute first. Go ahead and let it relax down. Do it again, nice and slow. Immediately. So that's good. Go ahead and let it go down. And do it again. Good. And do it again. Good. Do you feel a difference there now?
Oh yeah, no pain.
Low pain. That's good.
Yeah, no pain.
No pain. Okay, that's even better. So I'm going to go ahead and get a little bit more of that residual by using a percussor. And a percussor actually relaxes those muscles really deep inside. That was a huge crack, man.
Yeah.
Did you feel it?
Oh yeah, I felt all kinds of things.
So we always want to make sure that we treat appropriately. So in addition to doing the adjustment, which opens up that facet and alleviates that rib discomfort, we want to make sure that we get those muscles stabilized as well. Because what we don't want to see is the patient leave and have the exact same thing over and over and over again. We're all about getting you better quickly, getting you doing what you want to do. So in and out of the office as quickly as possible, because nobody wants to see the doctor over and over and over again. Does that feel good?
Oh yeah.
Yeah. So the benefit of this type of treatment here is called a percussion treatment, is it actually stimulates the part of the nervous system that has to do with chronic pain and new pain. So when we leave it on here, it actually is creating endorphins in his brain. So we're going to leave it on his lower back until he tells me that his feet start till his feet starts to feel like they're tingling. How's that feel?
Feels wonderful.
Feels wonderful. I like wonderful. Is your feet tingling yet?
No, it could take a while.
I think he's trying to milk it. Okay, put your head all the way down for me. Good. So sometimes it takes a little bit for it to actually happen. Relax your lower back. Good. So I'm going to go ahead and slowly take off the percussor. How's your feet feel now?
Yeah,
Now they're starting to feel tingly. So I'm going to slowly take the percussor off, and when that percussor comes off, if we've done our job, he's actually going to feel like he's floating in the air. And it's a really, really neat sensation. So Dustin, go ahead and tell me how it feels when I take the percussor off.
Okay, yeah. Whoa.
Did it kind of feel like you're levitating a little bit?
Yeah, my whole body felt like it lifted.
Yeah.
Almost like being a cloud.
Yes, there you go. So that's a really good indication again that we've got some good improvement on his the pain relievers, on his position sensors in his spine, and that we've given his body the break that it needs in order to start to heal. Does it feel still feel pretty good?
Oh yeah.
All right. Go ahead and stand up for me, and let's go ahead and check out those two maneuvers that were causing some pain. So before, remember, he was lifting one leg up and then he was bending that knee. So go ahead and bend to the left for me. So you can see right now he's actually able to plant his leg. Does that feel different now?
Oh yeah.
Good. Now how about the other side towards me? And you can see he bends it just a teeny bit, so you must have a little bit of inflammation still in there. How's it feel though?
Yeah, good. No pain.
Good. And go ahead and lock your knee, see how it feels now. Okay, now bend towards me. How's it feel now?
Good.
Okay, good. And bend forward and see how it moves. Good. And you can see automatically there's actually no big bump sticking out of here again, so that's good. And come back up and bend backwards. We had that mid-back issue. Good. How's that feel now?
Great now.
All right, so is that good?
Yes, I like that.
All right. There you go, guys. That's a full-on exam of the lower back from Facet syndrome. Massive crack in the mid-back area at your Spokane local chiropractor. I'm Dr. Wellwood.